Good afternoon everyone. So today I am going to tell you about this September month. We are in September and it is a childhood cancer awareness month. So we are going to talk about these kids who get cancer, a little bit about pediatric cancers. So we are talking about beacon of hope in pediatric cancers. So if we see, each year in the world 4 lakh children and adolescents are diagnosed with cancer. Out of these, survival rates in developed countries are 80%. Now if you see scenario in India, each year 76,000 children and adolescents are diagnosed with cancer, but if we see the survival rates, only 45% in lower middle income countries. So if you see the overall scenario, the bigger balloon is showing the cases, the inner balloon is showing the deaths. So if you see the Asia and Africa, the inner balloon is quite big. Out of 128 million cases, 46 million deaths. In Africa, out of 36 million cases, 21.4 million deaths. Whereas if you see the American countries, European countries, the inner balloon is so small. So we have to go a long way in providing good cure and good treatment to children with cancer. So why we want to talk about pediatric cancers? Why pediatric cancers are so special? Because they are not related to environmental or lifestyle factors. The way the adult cancers depend on smoking and various other risk factors, alcohol, but children are not exposed to such risk factors. There is genetic predisposition seen in 10% of cases. It is said that the pediatric cancers develop because of developmental accidents during tissue morphogenesis. And most of the pediatric cancers are biologically very aggressive. So they are totally different from the adult cancers, which are not as aggressive as the pediatric cancers are. And we get a totally different spectrum of cancers. The cancers which we see in children are not even heard of in adults. Many of them are not even heard of in adults. So this is a spectrum of cancers. So the bulk of cancers is blood cancers, which includes leukemia 28% and lymphoma 18%, followed by brain tumors 22%. And rest, if you see, soft tissue sarcomas 9 to 10%, GCT germ cell tumor 10%, and these neuroblastomas, retinoblastomas are not at all seen in adults. They are 6% and 2% respectively. So let us talk about hematological malignancies in this. We are talking about the cancers that affect blood and lymphoid system, which are defined into two groups, leukemia and lymphoma, and they have got myriad presentation. So we see how they present to us. So first let us see what are the spectrum of diseases which we see in hematological malignancies. Acute lymphoblastic leukemia, acute myeloid leukemia, non-Hodgkin lymphoma, Hodgkin lymphoma. So these are mainly seen in pediatric. Chronic myeloid leukemia, yes, it is seen in pediatrics but to a lesser extent, and again myelodysplastic syndrome is again an adult disease, but it is seen in pediatrics also. So these are the signs and symptoms. So if you see the signs, fever, because the 3 important cell lines affected are WBCs, RBCs and platelets. So fever because of poor immune system, PTK is because of thrombocytopenia, and pallor because of anemia. Then there could be lymphadenopathy. So all hematopoietic organs, which include lymph nodes, hepatosplenomegaly, again these are hematopoietic organs, and because of expansion of these tumor cells in the marrow, there could be bone pains. Apart from this, we have jaundice because of hemolysis. It could be because of pressure on the common bile duct, or because of enlargement of lymph nodes. There is weight loss, there could be weight loss, night sweats, there could be joint swelling. So patient might present to any doctor, they may not present directly to a hematologist. So joint pains, patient can present to an orthopedician or even to a rheumatologist. There could be a mediastinal mass, which is like a lymph nodal mass seen in lymphoma. There could be SVC syndrome because of pressure on the superior vena cava, causing dilatation of the neck veins. Then there could be tumors which are infiltrating in the orbit, like chloromas, which are seen in AML, causing orbital masses, facial palsy because of neurological involvement, spinal masses, and there could be expansion of the bone leading to fractures also. So now we see a patient which an abnormal report. So we recently had a patient with this report like 2 days back in the OPD. So if you see the hemoglobin is 6 gram, if you see the WBC count, it is so high, it is 3,24,000, and platelet count is low, 50,000. So this is the usual picture, which is an abnormal CBC report, and which straight away leads us to think about acute leukemia. When we saw the peripheral smear, we saw that the blasts were 86%. So blasts are the abnormal cells. So now what are the do's and don'ts which you should look in such patients? So we need to refer the patient to the slightest suspicion. So any patient who is having suspicion of having a malignancy, especially hematological malignancy, must be immediately referred to a higher center treating such patients, because the disease is very highly progressive and can lead to metabolic complications. Do not give any steroids prior to referral, as they mask the picture and delay the diagnosis of the leukemia. Do not transfuse unless the patient is severely anemic, decompensated or bleeding, because if you transfuse a patient with such a high counts, there will be a further hypercoagulable state. And it is important to start antibiotics if there is an obvious focus of infection. So if we talk about the pediatric solid tumors, we have a different spectrum. So some of the tumors you will never hear in the adults. So Wilms tumor, which is a renal tumor, retinoblastoma, medulloblastoma and brain tumors, hepatoblastoma, neuroblastoma, rhabdomyosarcoma, Ewing sarcoma and osteosarcoma. So these are the pediatric solid tumors. So what are the manifestations of different pediatric tumors? If you start from the head to the toe, so in brain tumors you will have morning headache, vomiting, diplopia, imbalance, increasing head size. In retinoblastoma you will have wide pupillary reflex, strabismus or fixed pupils. You can have neck in the nodes which are not responding to antibiotics. You can have, because of mediastinal masses, you can have difficulty in breathing, bulging of chest, stridor, dysphagia. You can have abdominal masses, urinary symptoms or urinary retention because of pressure on the urethra. You can have swelling around the joint or limping in case of bone tumors. So these are the clues to different solid tumors. In children, this is a mnemonic CHILDREN, which is continued unexplained weight loss, headache and vomiting, eye increased swelling, lump in abdomen, development of white pupil, recurrent fevers not caused by infections, excessive bruising and notable paleness or tiredness. So I'll quickly take up one or two case scenarios. In this, a 14-year-old boy presented with fever, body ache and neck swelling and taken some medication. Now he has increased lethargy and decreased urinary output. If we do physical examination, the child was dull looking, dehydrated, had pallor, tachycardia, cervical lymphadenopathy and hepatosplenomegaly. So this was what we found on evaluation. Hemoglobin was low, 6.6, WBC was 1.5 lakh, platelets were 33,000. If you see, creat was raised 2.1, calcium was low and uric acid was so high, it was 15. So what do we call it? This, we just look at the peripheral smear, we found so many blasts on the smear. So this is acute leukemia with tumor lysis syndrome. This is a medical emergency. It presents with short history, signs of organ infiltration. You need to look at the CBC and peripheral smear to make an accurate diagnosis. And it is very important to look at the metabolic parameter to find out the tumor lysis syndrome, which could be detrimental. And if there is excessive bleeding, you have to do for coagulation profile. This is another patient who presented with pain and swelling in the right knee for 2 months and difficulty in walking for 2 weeks. There was no history of trauma. But when you do an X-ray, you see this. Can anyone tell me what is this? This is called as sunburst appearance. So this is a sign. This was osteosarcoma. This is patient number 3, 4-year-old girl presented with large, smooth, solid mass on the right side of the abdomen, noted incidentally during examination. Otherwise, she is well and playful, but her blood pressure is on the higher side. So 110/80 is higher blood pressure for a 4-year-old. So this is what you see, and this is what you see on the CT abdomen. So you see a large renal tumor. So this is Wilms tumor. So in the end, I would like to say that most childhood cancers can be cured. In most cases, the treatment is inexpensive and treatment is cost effective. So what hope we have? We know that the children have greater effectiveness to cytotoxic chemotherapy. Their 5-year survival is much higher than survival of adult, is 75 to 90%. And if you save the life of one child, you save a whole lifetime. So it is very important to treat these curable cancers. So this is just a data showing the curability. Look at the Wilms tumor survival, 96%, Hodgkin lymphoma 98%, ALL 90%. These are highly curable. But what are the hurdles in treating pediatric cancers? The hurdles are many, like late presentation, abandonment of therapy, financial problems, underdiagnosis, malnutrition and lack of supportive care. So it is very difficult for us to be doctors of children who are having cancer, and it is very difficult to counsel the family because it is really heartbreaking for them. But we have many helping hands apart from our government or hospital. These are the NGOs which are helping in various ways to support the children with cancer. In the end, I would like to say pediatric cancers are treatable, but the management is complicated. There is no substitute to good clinical history and examination. Cancer in children differs from cancer in adults, and treatment requires a team of specialized healthcare givers. All three modalities of treatment, chemotherapy, radiotherapy and surgery, might be used along with good supportive care. That's all for today. Thank you.